Ophthalmic examination and findings in Silver Arowana. The Silver Arowana osteoblossom bicercosum is a large and beautiful freshwater fish that has quite a reputation in the aquarium community. For many, it is considered to be the pinnacle fish of the hobby. Hailing from the Amazon River basin in South America, these fish are revered for their looks and predatory behavior. Often referred to as dragonfish or monkey fish, silver arowanas are highly aggressive fish and have some demanding care requirements too. By the way, I am Dr. Ramani Chandrasekharayar, Chief Veterinary Ophthalmologist of Animal Nethralaya, a unit of NRK Pet Surgical and Eye Clinic in Chennai. A 5-year-old arowana suffering from an ocular issue was referred to Nethralaya for expert opinion, and myself along with Dr. Pushkin Raj, Assistant Ophthalmic Surgeon, examined the fish in its normal environment. The average lifespan in captivity for this fish is 10 to 15 years range. As in man and domestic animals, the ophthalmic exam is often a useful indicator of systemic diseases problems in fishes too. In the history, especially, important considerations included previous trauma from capture, aggression by tank mates, and previous infection by bacterial or viral diseases, and diet. Many ophthalmic diseases are associated with deficiency diets, including deficiencies of vitamin B, zinc, and amino acids such as methionine. The clinical examination began with a visual examination on behavior. Blind fish often become less aggressive and less territorial. A close examination of the eye was attempted, which revealed a dilated pupil in the left eye and constricted pupil in the right eye. The anterior segment was examined with a slit lamp biomicroscopy, and binocular indirect ophthalmoscopy was performed to examine the posterior segment. Exophthalmia, commonly known as purple eye, is often a sequelae of many systemic diseases of viral and bacteria, which usually occurs in both the eyes, were ruled out in this fish as the condition is unilateral and the eyeballs were also of normal size. Now, the fish was restrained in the tank corner with the help of a net trap, and the face was placed towards the wall of the tank so that examination could be carried out without any movement of the fish. Now, slit lamp biomicroscopy. The anterior segment exam included cornea, anterior chamber and lens. Visualization and localization of lesions in these structures is facilitated, and corneal damage and cataracts, though they are common, were not observed on examination. Whereas in the right eye, it revealed a normal cornea with a shallow anterior chamber and myotic pupil, and the pupil was also static. There were also adhesions onto the transparent lens, and edema of the iris was also noticed. In the left eye, a normal cornea with a normal anterior chamber was noticed with a dynamic pupil. The lens was also seen and spherical and transparent. Mild scattered opacities were also observed. Now, we will see the posterior segment. So, binocular indirect ophthalmoscopy. Examination included vitreous and lens, retina. So, there is little information on either normal and abnormal fundoscopy anatomy in fishes. And a more convenient approach is to use indirect ophthalmoscopy. But that was done here in the fish tank itself. So, that actually allowed a rapid examination, and which is now tried first time as a ophthalmic examination procedure for fish. In the right eye, fundic reflection was not visible, whereas in the left eye, a dark yellow fundic reflection was seen, which was hyperreflective, and hence the intensity was reduced in cats when we do the exam to reduce the light. So that was done in fish also. The fish was visual and reactive on the left eye and could follow the food pellets easily, but the right eye was found non-functional. So on perusal of literature, ophthalmic examination in fish were done only under anesthesia. So in this method explains the initial exam that can be carried out with a simple restraint under water. Thank you.